Well, the most common medical emergencies that occur in a dental office are fear and stress related. Over half of all the medical emergencies were fainting, syncope. And then we had things, other stress related things like angina, seizures, asthmatic attacks, hyperventilation, which are all stress related. Now there are other problems such as allergy, whether it's mild allergy, which is itching, hives, and a rash, or the more serious anaphylactic reaction, the myocardial infarction known as a heart attack, cardiac arrest, which are not stress related. They can happen at any time. I've been told by a number of dentists at my lectures after I discuss the emergency kit, Dr. Malamed, I consider myself to be a good dentist, but I would be reluctant to use any emergency drugs other than oxygen because I really would be uncomfortable. I'm not sure what's going on. And I agree, if you are not sure what's going on, other than that one drug, oxygen, you don't want to start giving drugs to a patient. But I also argue that point because you are a doctor. And as a doctor, we have an obligation to that person. And that person who sits in your chair voluntarily allows us to inject drugs into them, local anesthetics, allows us to pick up a forceps, a scalpel, and cut. You know, we're doing things that are good for a patient, but bad things can always happen. And you have to, as a doctor, you have to be prepared to handle what can happen. Stuff goes wrong. Stuff doesn't go wrong often in dentistry, but it does. You can't predict when and where a medical emergency will happen, but you can influence the outcome by being prepared, up to date, and mobile.
Health First's SM Series emergency medical kits provide organization and mobility for your emergency medications, portable oxygen, and AED. They are designed for the dental practice that needs to be compliant and prepared for a medical emergency, in or near the office. Dr. Stanley Malamed and the Health First Medical Advisory Board recommend 7 essential medications, which form the base of any emergency medical kit that is intended to address the most common emergencies that occur in the dental office. In addition to personal protection and medication syringes, all models of Health First's SM Series emergency medical kits include an albuterol inhaler, which is used to treat an asthmatic attack, diphenhydramine for intramuscular injection, which is provided to treat non-life-threatening allergic reactions, chewable aspirin, which is administered as part of the MONA protocol when myocardial infarction is suspected, nitroglycerin, a coronary vasodilator, which is used to provide relief from angina. SM Series kits offer nitroglycerin in a lingual tablet or easy-to-use spray. Oral glucose gel is provided to treat diabetic or hypoglycemic patients during a blood sugar emergency. When body repositioning fails to work, ammonia inhalants are provided to help awaken patients who have fainted. Epinephrine is the only medication that can stop a life-threatening anaphylactic reaction. A pre-filled auto-injector is the easiest and most reliable way to administer the correct dose of epinephrine via intramuscular injection, even through the victim's clothes. SM Series kits provide an adult dose auto-injector, and in some kit models, a pediatric dose auto-injector. To treat a biphasic anaphylactic reaction, the SM Series kits provide up to 6 backup adult doses of epinephrine 1 to 1,000 in 2 ampules. In addition to the 7 essential medications, it is recommended that dental offices who provide oral conscious sedation also keep on hand opiate and benzodiazepine reversal agents, such as naloxone and flumazenil. Oxygen is only effective if you can get it to the patient's location. The mobile cart makes it easy to get your portable oxygen and emergency medical kit to the patient who may need help at a location that is out of reach of your central oxygen system. All medications have a limited shelf life, but once you receive your SM Series emergency medical kit, you never have to worry about your kit's medications expiring, because with Health First's automatic refill system, drugs are tracked and replaced before they expire, which keeps your dental practice compliant and prepared for a medical emergency. Health First also provides easy and environmentally responsible disposal of your expired medications. Each medication refill shipment includes a prepaid, pre-addressed envelope for disposal by mail of your unused medications. For over 40 years, Health First has maintained emergency medical kits for dental practices. We are registered with the FDA, DEA, and have verified accredited wholesale distribution accreditation from the National Boards of Pharmacy. Over 50,000 dental practices trust Health First to keep their medical kits up to date and compliant. To order your new SM Series Emergency Medical Kit, portable oxygen, or easy-to-use AED, contact your authorized reseller. Purchase online at healthfirst.com or call Health First at 800-331-1984. Health First, for your practice, your patients, your planet.